Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and preparing well for upcoming NORCET and RRB examination. So we are posting important topics as well as important MCQs for the nursing competitive exam. So please kindly subscribe our channel so that you will get to know about our all the updates. Okay. Today we are going to see a small topic. So before that, we'll start with a small quote. You are never a loser till you quit trying. மற்றவங்க சொல்றதுனால நீங்க வந்து ஒரு வாழ்க்கையிலயோ இல்லை ஒரு எக்ஸாமினேஷனோ தோத்தவங்களா இல்லை. அது எப்போ தோத்தவங்கன்னு எப்போ நீங்க நீங்களா ஒத்துக்கிற வரைக்கும். ஸோ ப்ளீஸ் ட்ரை ஹார்டர், ட்ரை அகைன் அண்ட் அகைன். டெஃபினெட்லி யூ வில் சக்சீட் இன் யுவர் எக்ஸாம்ஸ். ஓகே, வில் ஸ்டார்ட் டுடே செஷன். டுடே வி ஆர் கோயிங் டு சி the most important and repeated questions from previous year staff nurse examinations. Right. Okay. So first question. What are the plasma soluble substances that are secreted by gram-positive bacteria or called? Options are endotoxins, exotoxin, toxin, none of the above. So the question is asking that, so whenever any bacteria is coming to our body, that will release us some toxins, right? So they're asking about the gram-positive bacteria. So those bacteria list what type of toxins? So the correct option is option exotoxins. What is exotoxins? Exotoxins are soluble substances, okay, that are secreted by gram-positive bacteria. These toxins are released in our body when they are exposed when they are entering in our body. Okay. What is endotoxins? Endotoxins are secreted by gram-negative bacteria. Okay, gram-negative bacteria. So once again, I'll show the picture. You can see it here. Exotoxins are from those bacteria will releases those releases the protein from their body. Okay, they releases the toxins from their body. But endotoxins, their membrane, their surrounding membrane itself, it is a toxin. Clear? So other than that, we have so many differentiation between these two. What are they? Exotoxins are both the gram-positive and gram-negative, but mostly it's gram-positive only. Endotoxins are from gram-negative. So examples of exotoxins are cholera, tetanus, botulinum. From the endotoxins, we can say E. coli, salmonella, meningococcemia. So for exotoxins, we have vaccines are available because it is formed from the toxins. But endotoxins, we don't have any vaccines are available. Clear? So according to these questions, gram-positive exotoxins, gram-negative endotoxins. Okay. So next question. Question number 2. Neonate of diabetic mother is at risk for all of the following exams. They're asking about what is the complication that neonate will have if the mother is having diabetes. Okay. Hypoglycemia, hypocalcemia, hyperglycemia, hyperbilirubinemia. The question is except. Okay, remember that except. So the options are, we already discussed, hypoglycemia, hypocalcemia, hyperglycemia, hyperbilirubinemia. So the correct answer is except hyperglycemia. Remaining all three symptoms will be there for the neonate because of the diabetic. So we'll discuss why hypoglycemia is happening. Option A, why this neonate is getting hypoglycemia. So when the mother is having too much of sugar in the body, okay, when the mother is having too much of sugar in the body, that will supply to the fetus also, right? So that fetus pancreas will secrete more insulin. Hyperinsulinemia will be there. So too much of insulin will lead to the hypoglycemia to the neonate. So that is the pathophysiology, right? So why hypocalcemia is happening? Similarly, because of hyper glucose level of a mother will suppress the PTH, parathyroid hormone of the neonate or fetus. So that suppression leads to hypocalcemia, right? So because the parathyroid hormone is the main hormone for the calcium regulation. So that will be suppressed due to the hyperglucose of the mother. Next, coming to the hyperbilirubinemia. Why it is hyperbilirubinemia is happening to the neonate? Too much of insulin will produce too much of RBCs in the neonate circulation. So those increased RBC, that is polycythemia, can lead to destruction of the RBC. So what is the end product of RBC destruction? That is bilirubin. So that is why hyperbilirubinemia is happening. Clear? So when the mother is having hyperglycemia or a diabetic mother, so that will lead to these many complications. So you can see it here, the congenital abnormalities, what is happening to the mother, what is happening to the neonates. You can go through this video again, so you can read it, pause it and read it, everything. Okay. We can see it here, right? Yeah. Hypoglycemia, hypocalcemia, hypomagnesemia, and hyperbilirubinemia because of polycythemia. Clear? Okay. Next. GFR is increased by GFR, everybody knows, glomerular filtration rate. The options are atrial natriuretic peptide, histamine, vasopressin, endothelium. Why there is an increased GFR? Which is the mechanism which causes the increased GFR? So the correct answer is option A, atrial natriuretic peptide. What is this ANP? Atrial natriuretic peptide. It is a hormone which is secreted by the heart. Okay. So heart, especially in the right and left atrium. So that is why its name itself atrial, right? So these are, what is the function of this ANP in the heart? It will regulate the blood pressure. So whenever the cardiac muscle stretches, too much of tension, too much of blood content is there. So this ANP will regulate the blood pressure. Not only in the cardiac muscle, it is also helps in the kidney and vascular system and nervous system. In kidney, it increases the GFR, and in the vascular system, it leads to vasodilation, as well as in the nervous system, sympathetic nervous system inhibition. So many functions are there for this ANP, but it's primarily secreted in the heart, right? Okay, so the correct answer is option A. Next question. Fracture of a distal radius is called what? It's an easy question. The correct option is Cooley's fracture. So we have two types of distal radius fractures. One is Cooley's fracture, one is Smith fracture. So what is the difference between Cooley's and Smith? Both are distal radius only. So what difference is, the Cooley's fracture is outward. So you can see this is the palm, right? When your injury is happening, this outward pressure, that will cause Cooley's fracture. When it is inward, when the person is getting the inward fracture, that will lead to the Smith fracture. So that is the difference between the Cooley's and Smith. Both are distal radius only. A complete cut will happen. But which one is very most serious? Smith one is more serious because the neurovascular structure is made damage, right? So that is why Smith fracture is too dangerous, right? So we'll see other fractures which are given in the options. Humi fracture, Galaxy fracture, Montague fractures. What is Humi fracture? Humi fracture is nothing but it is an elbow fracture. The fracture of the olecranon process with the anterior dislocation of the radial end. You can see it in this image, right? So this is a elbow fracture, especially seen in the children. So what is that Galaxy and Montague fracture? MUGR. Remember that MUGR. Montague is ulnar, Galaxy is radius. We'll see this picture. You can see it here. Montague. Montague is what? MU, as I said. Montague is ulnar. Ulnar fracture of the dislocation of the radial head. Ulnar fracture with dislocation of the radial head. That is MU. What is Galaxy? Radius fracture with dislocation of the distal radio-ulnar joint. You can see it here. Radius fracture is there. Distal radio-ulnar joint is there. You can remember MUGR. Montague, ulnar, Galaxy is radius. Clear? Okay. Next question. Nelson syndrome is seen after when? Options are adrenalectomy, hypopituitarism, hyperpituitarism, and deficiency of the growth hormone. So the Nelson syndrome is seen after adrenalectomy. Why we will do the adrenalectomy? When the patient is having Cushing syndrome, it is not treated by the medications. They will go for a bilateral adrenalectomy. So complication of this bilateral adrenalectomy, what will happen? there will be an increased ACTH, which leads to pituitary adenoma. That is growth and growth of the pituitary gland. That leads to hyperpigmentation, amenorrhea, so many symptoms will be there. So it is a complication of the adrenalectomy. Clear? Okay. So that's all about today's session. Thank you so much. If you like the session, please press like button. If you have any doubts, please type it in the comment section. We'll see you with a new session with the new questions. Thank you all. Please subscribe and pass it to your friends who is preparing for the competitive exams. Thank you all. See you in the next class.